Hello everyone, I am Dr. Gaurav Bhandari, nephrologist and transplant physician. Normal function of kidneys is to purify the blood. The blood goes inside the kidneys purify it and throw out the waste products into the urine. When the kidneys are not able to do this function, someone has to do this function. So there comes the role of dialysis. So in dialysis, there is this machine where the blood goes into the machine purifies the blood and gives back the pure blood into the body. So the function of the kidney is replaced by dialysis. So dialysis machine help us to remove the waste products, the extra water from the body, which the normal kidney does. Our kidneys are functioning 24/7. So if the kidneys are not functioning, then only we offer the option of dialysis. So dialysis is something which the patient has to do twice a week or thrice a week, depending the patient's condition and clinical status. Dialysis is like breathing because you have to breathe if you want to be alive. So dialysis has to be continued if you want to be alive. The dialysis removes waste products and that is produced, the waste products are produced continuously into the body. So we need to do dialysis on regular intervals to remove those waste products. So it cannot be stopped. It has to be done at regular intervals so that we are free of waste products. Dialysis, as I said, it has to be done on regular intervals. So normally we do around 3 to 4 hours of dialysis and we do it thrice a week, 3 times a week on alternate days. Sometimes in some patients, if the patient is more symptomatic, if the patient has more waste products, if it's not able to throw out the waste product in 3 times of dialysis, then we can sometimes extend the dialysis to 4 times or 5 times a week. And depending the duration, 3 hours, 4 hours, 6 hours, depending on the patient's condition. So on an average, more than 50%, 90% of patients are on thrice a week dialysis and duration of 4 hours each dialysis. In between, definitely, if the patient has gone to kidney failure, stage 5 CKD, there are really less chances that the dialysis can be stopped. If the patient is acute kidney injury, where sometimes we have to do dialysis on temporary basis till the kidney functions recover. In such cases, dialysis can be stopped till the kidney functions improve. And once kidney starts improving, the kidney will take their own role. So in acute cases, definitely we can stop the dialysis. But in chronic cases where the patient has reached stage 5, then it's very difficult to stop dialysis. Certain dietary restrictions are to be followed for every kidney disease patients. Like sodium restriction is needed. Sodium has to be cut down in all the kidney disease patient and dialysis patient. Second, water restriction, because if the kidneys are not functioning, they are not able to throw out the extra water from the body. So the water gets accumulated in the body. So if the patient drinks more water, the more water will be accumulated. There will be swelling, there will be breathlessness and other complications. So definitely the water also has to go down. The salt restriction, water restriction, these are two important things which are to be cut down. Thirdly, the protein intake. In a kidney disease patient who is not on dialysis, we restrict protein. We give less protein so that there is less of kidney injury and kidney disease can be, the progression of the kidney disease is try to slow it down. But when the patient is on dialysis, we advise high protein diet. So patient has to take good amount of protein because some amount of protein is lost in dialysis. So protein intake has to be increased. The protein, the source of the protein, it can, the patient can have non-veg, but the patient can have high protein, low salt, low water. These are the three important restrictions. And definitely the junk food has to be avoided and the outside food has to be avoided. Every procedure comes with its own risk. Dialysis, where the blood is removed from the body at 250 ml per minute, or the blood flow is 300, 350. So when the blood is removed, there is always a risk of low blood pressure, which is known as hypotension, intradialytic hypotension, what we call. So there is always a risk on the heart as well. There can be sometimes arrhythmia, which is the heart is beating irregularly sometimes. Then secondly, the blood pressure can go down suddenly. There are certain complications associated with like fistula. If the patient has AV fistula, so sometimes a big swelling can go on that side. Sometimes if the patient has catheter related infections can happen. So definitely there are risks associated with dialysis. But if the patient has kidney failure, then we have to weigh the pros and cons of dialysis. And I think always the dialysis is better compared to non-dialysis in patient of kidney failure. And we have to go with dialysis. So we try and rectify and advise the patient what all precautions to be taken so that the patient doesn't have much of complications.